Noswaith pawb. Da ci wedi cael wythnos dda gobeithio, a dechrau da flywydden. As we roll into 2021, my inbox is full of questions about the COVID-19 vaccination program. And so I want to take this opportunity to provide you with an update and to answer a couple of the main questions that I've been asked. First, I want to remind you that in spite of any confusion or frustration surrounding this initial phase of the vaccination program rollout, this is an overwhelmingly positive news story. The UK was the first country in the world to approve not one, but 2 vaccines for public use, the Pfizer-BioNTech and the Oxford-AstraZeneca vaccines. Today, we've also heard the great news that a 3rd vaccine has been approved for use in the UK, the Moderna vaccine, which we rolled out in the spring. Incredibly, these vaccines have been developed, tested and approved for use less than 12 months after the first case of COVID-19 was confirmed on our shores, and barely a year after the virus was first identified worldwide. We are the first country in the world to embark on a mass immunization program against COVID-19. Vaccine supplies are already coming into the country, and the supply volume will increase over the coming weeks. We have already secured 100 million doses of the Oxford-AstraZeneca vaccine, 40 million doses of the Pfizer-BioNTech vaccine, and 17 million of the Moderna vaccine for delivery. So there's plenty to go around. To return to my inbox, I've been asked why there's an apparent lag between the rollout of vaccinations in England and Wales and between the South and North Wales health authorities. I can assure you that the vaccine is being distributed to health authorities as fairly as possible. As of this week, BCUHB has received 8,050 shots of the Pfizer-BioNTech vaccination and 5,000 shots of the Oxford-AstraZeneca vaccination. The data I received yesterday showed that BCUHB had administered over 10,571 vaccinations to date. This is the first time this country has mobilised a mass vaccination programme on this scale in reaction to a pandemic. Mobilising an operation like this requires massive coordination and resource, and our NHS is doing it at a time when it is already hugely challenged by an increasing number of people needing treatment for COVID-19 and reduced staffing levels due to self-isolation. In addition, one of the significant challenges faced by Betsy Cadwallader University Health Board just now is how to deliver the vaccine into the arms of the people who most need it, across a very large and primarily rural area. The Pfizer-BioNTech vaccine, which was the first to become available, has very specific storage and transportation needs, which made it difficult to distribute into rural areas. The vaccine needs to be stored at -70 degrees. And for that reason, BCUHB prioritised distribution to its 3 mass vaccination centres, or MVCs, and its 3 hospital vaccinations, or HVCs, rather than out to care homes. This meant that care home and frontline NH staff have been prioritised because they could travel to the MVCs and the HVCs for their vaccinations. With the introduction of the Oxford-AstraZeneca vaccine, which can be stored at room temperature, supplies can now be distributed into care homes and out to the wider community. Going forward, we expect to see more venues open up as vaccination centres include GP surgeries. We expect that vaccinations will be carried out at a range of venues, including GP surgeries, although full details have yet to be confirmed. I've also been asked who will receive the vaccination first and how. BCUHB's priorities for vaccinations the first 2 weeks in January are care homes, care home residents and their staff, people aged over 80, including hospital patients, high-risk frontline healthcare staff, primary care staff, and Welsh Ambulance Service staff. By the end of the second week in February, they're expecting to have provided initial vaccinations to all those 80 years of age and over, and frontline health and social care workers by the end of the second week in February. If you're in a care home, then your care home should receive details of vaccination schedules, although it is possible that this may be at short notice. If you do not live in a care home but you fit into one of these groups, then you should expect to receive a telephone call or a letter inviting you to a centre for vaccination. I would urge you to please to not contact your GP to ask when you'll be called for vaccination. Our GP surgeries are already under immense pressure and they're unlikely to know because the system is being centrally administered. However, if you fit into one of these groups and you've not received notification by mid-February, please contact my office and we will try to help. Please remember that it's critically important that you follow the Welsh Government Level 4 guidelines so that you can stay safe and keep our community well. I reiterate that this is a very fast-moving and sometimes frustrating situation, but the UK is in the fantastic position of having 3 approved vaccinations, sufficient supplies coming through for the whole population, and we are at the forefront of the global vaccination programme. I applaud and sincerely thank everyone who's been involved with the development and rollout of the vaccinations and all our frontline and key workers, whatever capacity they are working in. I'll end by saying, diolch yn fawr, wela I chi wythnos nesa. Hwyl.